Hey everyone, Tony Maritato here, and welcome to the Total Knee Replacement Support Group YouTube channel. But today's first question comes from Richard. Richard's a 57-year-old respiratory therapist who had his right total knee replacement done 11 weeks ago. Richard was saying that he had 140 degrees of flexion, which is just phenomenal, and he's progressing well. But he continues to have this pain on the right side of his knee with activity. He said that before surgery, the pain was on the inside of the knee associated with the arthritis, but now since surgery, the pain is on the outside of the knee, and his physician and physical therapist are suggesting that it might be a tendinitis. So Richard wants to know what he can do for this kind of pain before he has to return back to work. As a respiratory therapist, Richard has to spend a lot of time on his feet, of course. And so let's talk about this situation in a little more detail. Now, I've never met Richard, so I can't give Richard any kind of medical advice. The information I'm sharing with all of you today is just for educational purposes only. You have to talk to your medical team, your surgeon, your physical therapist, anybody that you're working with. But what I hope to do is give you some general information that might help guide the process. So in Richard's case, after the knee replacement, we know that the cartilage is gone, so we know that it can't be an arthritic kind of pain. We know that the ends of the bone have been replaced with the prosthesis. Typically, the underside of the kneecap has been replaced as well, or cap has been placed on it. We know that the ACL and PCL, the ligaments within the knee, are gone. And so we've eliminated a lot of things that could be causing pain. But now what Richard said that's really important is that it's a different kind of pain than he had before surgery. So what could be some of the pain drivers? I think one of the things that happens is the implant that goes on the top of the tibia. So the tibia bone is essentially your shin bone. It's the bone that's at the bottom of the knee. There's an implant that goes on top. You can imagine visually that when the surgeon puts that implant in, it starts loading the bone differently. The forces going through the bone are not going to be the same forces as when you had your birth-given knee. And so there's absolutely a component that could be a bone pain, and it's very common that clients will have pain right along the outside edge of the tibial implant. And I believe that's because the new stresses and loading are causing the bone to have to adapt to new wear patterns. A lot of patients before surgery will have what we call a varus or a valgus knee. That means it's bowed out or it's bowed in. And then when the surgeon puts the new implant in, the leg all of a sudden becomes perfectly straight. So you can imagine if I have a knee that's curved to the outside, when it's replaced, now it's perfectly straight. I'm going to get a lot more compression on the inside and distraction on the outside compared to what it was used to before surgery. So certainly the pain you're experiencing could be the bone adapting to the new loading pattern from the new knee replacement, from the implant. Certainly it could be a patellar tendon issue, tendinopathy, tendinitis, because again, if that knee is shaped differently, the leg is shaped differently after surgery as before surgery, there's going to be different pulls, different strains along those tendons, and now those tendons need to adapt. So the conventional wisdom is initially you try rest, but from my experience, if you've rested 48 to 72 hours and you see zero improvement when you start activity again, then we need to look at it from a different approach. Instead of rest, we need to look at loading. We know from the most current research on tendinopathy that tendons respond well to tension. Tendons don't respond so well to compression. And so what does that mean? That means exercises that put force through the tendon, not so much to cause more damage, but enough to stimulate a healing response is what we're looking for. And the reason why I can't give you a prescription is because everybody's loading tolerance will be different day to day, week to week, year to year. And so you might respond positively to a more what we'll call a conventional rehab program, where let's say that you're doing 3 sets of 15 step down exercises to load the tendon eccentrically, or maybe you respond to isometrics where there's no movement at the joint at all, and you hold the isometric contraction for 10 seconds and you perform it in 3 different positions of knee flexion. There's lots of variability in the kind of program you would need, and you would need to consult your physical therapist to get the ideal program. But the goal here is the big picture. Understand that tendons respond to loading through tension. They want to be pulled on. And if you pull enough, they respond positively. If you pull too much or you pull too little, they respond negatively. I hope that gives you some direction and some information to talk to your physical therapist about. Look at an isometric loading pattern. Look at an eccentric loading pattern. Look for multiple episodes throughout the day in which you could load that tendon and load the bony structure without overloading it. Guys, I'll catch you on the next video. Submit your questions, post them in the comments below. Thanks so much.